Pfizer is going to wait to ask the FDA for approval on its COVID vaccine for kids under the age of 5. There's a lack of clear data. The 2-dose regimen generates, quote, sufficient immune response. Essentially, they're saying 3 shots might be needed to do the job, so they're asking parents to wait until April. Keep in mind, and the data is important here, COVID has virtually no impact on kids in this age group. Kids under the age of 5 have a 0.2% chance of dying if they're infected with the virus. So meaning even if they are tested, that's the number. There are 18 million kids in that group. Just over 400 kids have died in the past 2 years, according to CDC data. And critics and doctors have said that probably a lot of those kids had underlying health issues that put them at higher risk. We bring in Dr. Norman Baylor, who spent 20 years with the FDA. Most recently is the director of the Office of Vaccines Research and Review. Boy, Doc, you listen to some commentators, they seem so disappointed by this. To me, this is almost more of a success story of waiting to be absolutely sure.
Well, I think you have to put things into context and understand the difficulty of the decisions of the public health, such as the CDC and FDA. Here you have, children do, even given the statistics that you showed, children do get coronavirus disease. 18% of children, 18% of children make up the deaths in the United States, so 18% of children. And then so when you're looking at this and parents wanting to get the kids back to school and all of this, so you have one group of parents who are really eager to vaccinate their kids sooner than others. And then you have a lot of parents who are saying, wait and see, and they're sort of hesitant. So that's the sort of the backdrop of the decision making. Now, given that there are more data, I think it is the right decision to wait and review that data to determine whether a third dose is actually needed.
Yeah, no, hold on. Doc, I hate to ever jump in, and I never like to argue with somebody who's smarter than me, which clearly you are, but the CDC data of the 900,000 COVID deaths, 800 have been kids 0 to 17 years old. That's not 18%. That's less.
Not 18% of deaths, but 18% of cases.
Okay, but kids have the flu and lots of other things. You know, you made a good point about there's this division between parents. Kids 5 to 11 vaccinated, only 23% of parents have chosen to vaccinate their kids. If you're a parent sitting there and realizing how unlikely it is that your child is going to die, what is the incentive to give them something under emergency use that is so unsure or untested, I guess?
Well, keep in mind that there is the children also transmit disease. So they could transmit it to someone in their class or someone in their family who may be immunocompromised. So that's a concern as well. And so many households do have
I get that. Do you worry that this sort of back and forth and all these questions about the vaccine and Pfizer saying, no, wait, we need more time on and on, only increases the number of people who go, you know what, I'm probably going to wait a little while?
Yeah, I think it's very confusing, and I think it's very difficult in the way it was handled for parents to really be able to make a comfortable decision. So the messaging was quite confusing.
Yeah, no, it definitely. Yeah, I almost feel like confusing would be a nice way of putting it. Last question for you. In the situation we're in, where admittedly it is confusing, and you say that there's a lot of people who are going to want to wait, where do you see sort of this next culture war going? Because for so long we were told, oh, there's never going to be mandates. Well, now there's mandates for kids as young as 12 and 13 and 14 to go to school. They must be vaccinated. How long is it until there's vaccine mandates for kids 2 to 5 years old?
Well, there are mandates for children for other vaccines. So you have to keep that in context as well. So there are mandates from the states for other vaccines to get into schools. So the mandates are not something that's unusual here. We are in a pandemic. Kids can transmit. So I don't think it's given the interest of public health, I think that states and localities need to do what they think is best for their community. If there's high incidence in your community, then you may want to mandate masks and vaccines.
Boy, you think about 5 to 11 years old, only 23% are vaccinated. If that's mandated to go to school, there's going to be a heck of a fight. Doc, it was good to see you. Thank you.
Sure, thank you.
Great conversation.
Glad to be with you.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.